Tuesday, again from 1 to 2 p.m. And the title of that, or the topic, will be the Person-Centered Support Plan, an overview of it, and also how to interpret the reports that come from it. So with that, we will turn the time over to Rick Burrell to give us our training for today, Person-Centered Plans Decoded. Rick?
Okay, thanks for the introduction. I appreciate everybody here, as Lisa indicated, and you advance to the next slide. We'll look at the agenda for today. So what we're going to do is talk about what goals are and where they come from, what health and safety needs are, where they come from, what a service is, what a support is, what a support strategy is. And we'll look at some examples and how support coordinators can review those services at the PCSP's annual review. And we'll have time at the end for questions. So if you have questions, just go ahead and put them in the chat, and we'll address them at the second half of the presentation. Let's have the next slide. Let's start with what an important to item is. An important to item means that it is something that's important to the person. It comes from some defined sources. One is the UCAN's assessment. Items that are scored as a 0 or a 1 on the Domain 2 Client Strengths section of the assessment are automatically brought into the Person-Centered Support Plan as important to items. But that other important to items can come from sources like charting the life course, or essential life planning, and other planning tools like that. It can be entered into the Person-Centered Support Plan by hand. Next slide. This question is about what a goal is and what it means. In simple terms, a goal is something that is important to the person they want to achieve or experience in life. And the goal typically is expressed in their own words. Next slide. Here are some examples. These are some of my personal goals. Rick wants to plan family meals and cook the food at least 3 times per week. Rick wants to see his grandchildren every week. Well, a personal goal is something that is meaningful for the person. It's measurable, it's understandable, and it's written or structured in language that is meaningful for the person. So if I look at these goals, I know what they mean to me, and I know what they represent for me. Next slide. This question is about what an important for item is. An important for item is a health and safety issue that is important for the person to keep them healthy and safe. There are some defined sources that generate for items. For the UCANs, important for items come from domains 1, 3, 4, 5, and 6, where the item is scored as a 2 or a 3. And of course, a for item can come from other assessments like charting the life course or essential life planning. Next slide. So what is a health and safety issue? As indicated, it's something that's essential for the person's health and safety, and for their personal well-being. Next slide. Here is an example of a for item. Rick is likely to fall down when unassisted by an aid or adaptive equipment, meaning that he needs an aid or some kind of equipment to help him be stable on his feet. Next slide. A question that we periodically hear is, can UCAN's item be both important to and important for the person? Based on how UCAN's data is scored, the answer would be no. Important 2 items come exclusively from domain 2, and they have to be scored as a 0 or 1. That means the item is a strength for the person, as opposed to an important 4 item that would represent this health and safety need. They come from domains 1, 3, 4, 5, or 6, and they need to be scored as a 2 or 3, which means the person needs support in that area. So structurally, a UCANS item would not be both. It's either one or the other. Next slide. This question is about what a service is. DSP defines a service as something that helps the person participate more fully in their community and that can be tailored or customized to meet the person's needs. You could think of a service as a package that contains a variety of generalized support options that, if the person qualifies for, is eligible to receive. Next slide. Here we have an example of the service code description for supported living with natural supports, or SLN. Sometimes the service code descriptions have both eligibility requirements and support options inside. Sometimes they only have support options. But in this case, this is a good example of where it has both. The text that is highlighted in the dark color represent the eligibility requirements. The text highlighted in the light color represents support options. So for the person to qualify for supported living, they need to live with their parents or a relative. The parents or relative has to be responsible for the person's primary care. And the person needs intermediate support, accessing the community, avoiding isolation, and with activities of daily living. On the support options side, SLN can help the person with, and note the underlined word may, they don't have to have all of these options, but these are the options available through the service. It can help with personal care, with homemaker, chore, advocacy, communication, activities of daily living, transportation, shopping, tracking money in their bills, using the telephone, and some indirect services such as socializing, self-help, adaptive skill development, and so on. Next slide. This is the service code description for residential habilitation services, or RHS. This one only has the support options listed. Eligibility is separate. So RHS assists the person to live independently in the community by providing supervision, training, and assisting them with the activities of daily living, such as eating, bathing, and dressing. Next slide. This question is about a support and what it is. A support is a specific task that somebody is going to deliver to the person. It could be provider staff, it could be a natural support, but something specific, tailored, customized that the person needs. Next slide. Well, the question here is, what's the difference between a service and a support? The answer is, the service describes all of the general support options that are available to help the person. But the support should be specific, task-oriented, customized, targeted to something the person is going to receive or needs support with. So the concept about a support and a service are very different in scope, where the service is generalized. It lists all of the options available, but the support is targeting something specific, something the person needs, and generally should customize how that support option is delivered to the person. Next slide. Next question is, does every service require support? And the answer is no. The idea about a support is it should be specific, targeted, customized, task-oriented. If the person, well, if the service code description is sufficient to describe how the person's going to be supported, then a support may not be needed. An example is with support coordination. Support coordination is clear enough as a service set of options that a support coordinator may not need, and generally may not need, to create a specific task oriented around how the person is going to be supported with support coordination. But it's certainly possible the support coordinator could determine that they need to assign themselves a support for the person that's specific and targeted and customized that would help them achieve whatever they need to. An example could be that the person needs assistance with employment, and the support coordinators determine that they're going to invest some specific resources into helping them with employment. They could design a support that's specific and targeted around that specific issue in terms of achieving their employment. Another example is FMS. Generally speaking, FMS does not need a support because the service code description is sufficient to identify and describe how the provider supports the person. The physical intermediary supports the person. But it could certainly be that the support coordinator should write a support for FMS. But again, if that was the case, it should be specific, targeted, focused. In a situation where the person is just struggling managing their employee timesheets and they need some additional training or support from the FMS provider, then perhaps it would make sense to write a support about helping the person manage timesheets better and defining how the FMS provider will provide that level of support for the person. Next slide. How many supports should the person have? The answer is, it depends. The person's needs should dictate the scope and scale of the supports they receive. And that the conversation comes as a part of the planning process. The planning team can collaborate with that, depending on what the person needs and who the person wants to be a part of the conversation. So, but regardless of who's collaborating and who's participating in the conversation, they're focused on determining what level of support the person needs from the service options available to them. Next slide. Here's an example of what a set of supports could look like from supported living. So on the left-hand side, you see the package of service options that come with supported living. The person may need help with everything you see in the list. But then again, they may not. They may need support in just a couple of these areas. The people participating in the planning process with the person would look at these options and hopefully target the areas of support where they need help. On the right-hand side, you see the supports that have been targeted. In this particular example, the team has decided to target personal care, cleaning the house, and tracking the bills. So each one of those would get a separate support, each one targeted, specific, customized to demonstrate how the person's needs will be met by the provider. Next slide. What is the definition of a support strategy? The strategy defines the steps that's provider staff or whoever's supporting the person will use to deliver the support. Next slide. In general, a support strategy and a support would be one-to-one, meaning that if there's a support written about personal care, then the support strategy would be about how the person's personal care needs will be fulfilled. And if there's a support about cleaning the house, then there would be a support strategy about how the provider staff will fulfill that particular need. And the same for tracking the bills. If the support is too generalized, if it's too vague, then it makes it difficult for the provider to write an effective support strategy. So when the support is clear, targeted, specific, customized, the support strategy becomes very easy to compose and determine how to support the person's needs. Next slide, please. So then this is the general overview of the whole person-centered support planning package of how important fours and important twos lead to helping the person achieve what they want in life. On the important four level, important fours identify health and safety needs that then identify services used to address those needs. From service come targeted, customized supports, and from the supports come specific support strategies. And the support strategies then help the person achieve their goals. The important twos help generate the goal. Next slide, please. In this example, we're looking at how the support for personal care could actually be written. So on the left, we see all of the support options for supported living. And on the right, we have the support targeting personal care. In this particular example, Rick prefers to shower in the morning instead of taking a bath. He prefers to wash his body and his hair on his own, but he needs support getting in and out of the shower. He also needs to sit on a shower chair to keep from falling. Rick needs a verbal prompt to complete basic hygiene tasks like washing his hands and brushing his teeth. Next slide. Then from that kind of support comes a support strategy. The provider can then take this information and divine how they're going to support Rick while he's in services. So provider staff will make sure the shower chair is in the bathroom when Rick goes there. The provider staff will make sure that Rick can get on and off the shower chair safely. They'll help Rick put soap on his washcloth so he can wash himself. They'll remind Rick to wash his hands after using the bathroom and before he cooks. And then they'll remind Rick to brush his teeth. Next slide. The next big question then is, how does this support strategy help Rick achieve his goals? Well, Rick's goal for planning family meals and cooking 3 times a week is definitely impacted by his personal hygiene. If his hygiene practices are appropriate, then he will keep himself healthy, more healthy and safe, and those he cooks for, because he'll be less likely to pass pathogens into the food. He will cook food appropriately, and the situation will be better for everybody. Next slide, please. This question involves changing the person's support package and service delivery package. The question is, if Rick is being moved from a supported living setting to a residential setting, what would happen to the support? Should the support change? Fundamentally, the answer is no. Rick still needs support with personal care independently of the setting where he receives services. So the support should not change unless there's some external need to change it independently of where he receives services. Next slide. The next question is, should the support strategy change just because Rick is changing the setting where the service is being delivered? And again, the answer is generally no. Whoever is supporting Rick still needs to make sure the shower chair is in the shower, that he can receive help getting on and off the shower chair, that someone's going to help him put soap on his washcloth, that someone's going to prompt him about washing his hands, and someone's going to prompt him about brushing his teeth. Next slide, please. Should Rick's goal change because he is changing the service delivery setting from supported living to residential? And again, the answer generally would be no. What Rick wants out of life is independent of where he receives services. So his goal to cook for himself, for his family, remains intact, and he still needs support to make that goal possible. Next slide, please. This question is about how the support coordinator reviews the the services and supports in the plan. In this case, we have the service code SLH, and we have the support for personal care. How should the support coordinator go about reviewing each of these? On the service code level, they're considering different things than they are on the support level. The context of the support is generalized. It is in the terms of the delivery environment, the setting, and whether the support or the service makes sense to continue into the next plan cycle. So the review would be focused on those things, whether this support is suitable to continue supporting Rick's needs, whether the setting is appropriate, whether it should continue. On the support side, it's a completely different context. This support was specific, task-oriented, targeted, customized. So the review would be about those things. In this case, it's about personal care. So the review would target personal care. How well were Rick's personal care needs addressed? Was he kept healthy and safe in terms of managing his personal care? Should this support continue? Now, if you remember, one of the tasks identified in this support was verbal prompting. One of the questions that should be addressed is, should those verbal prompts continue in the new plan cycle? Or has Rick changed a little bit? Is he progressed enough where a verbal prompt is no longer needed? Or is there another way to achieve the verbal prompt? Perhaps Rick would do better if he was given an electronic device that had an alarm on it. And when the alarm, he's taught that when the alarm goes off, he should go brush his teeth. Or some other kind of method that may be more suitable for Rick's needs. So the bottom line is that the review of these items is not generalized. It's not a rubber stamp. It's not a canned text statement. They're focused around the context of what the items are about. All right, next slide. So we have some time now for questions. We've spent time talking about goals and supports and services. So we're happy to address any questions that you feel like would be relevant to those ideas. And we could go until 2 o'clock, so a little more than 30 minutes.
How does the PCSP come through?
Can you say that one more time?
The PCSP, when you get that from the support coordinator or from the coordinator, how do you get that? Like, is that through via email or?
The person-centered, well, for providers, person-centered plans are available in UPI.
Okay.
Depending on the user roles that the provider staff member has in UPI, they can pull down a variety of data about a variety of things: payments, incident reports, person-centered plans. So that would be the place to get the information.
Thank you.
And again, you're welcome to post questions in the chats and we can address them there as well.
So Rick, in the chat is the question, where is the best place to find the list of services for each billing code?
So inside of USteps, we have some resources that access other department systems. The department's storage of that information is not in USteps, so that they keep it in different repositories. So it's on, and for USteps for support coordinators, it's under the CAP searches. There's a search panel for service codes. You can look up the service code and it brings up the service code description.
What about for providers? Do they have access to that as well?
I do not believe a report is available in UPI for service code descriptions, but that is something we could add in if providers are interested in it.
Okay, and Nicole says support coordinators are supposed to copy and paste the service code description into each plan under services for each code? Question mark.
Is that one about whether they're supposed to or not? That sounds like.
Yeah, or maybe in response to the question about finding it, that the support coordinator should, yeah.
I think that's up to the support coordinator's discretion. There's no requirement that they have to do that, because the support is targeted and specific and customized to what the person's need is. So if the support coordinator would like to, they could, but it's not a requirement.
So Debbie asked about sending a copy of a PCSP to a reviewer to get suggestions on how the plan could be better. And I put our employment and inclusion team's email in the chat. You're always welcome to send them. We look at PCSPs, we look at employment pathway tools, and can definitely give advice and feedback. You're also welcome to send it to the USteps team if there's questions or problems. Question, how do support coordinators choose which provider they use for a service?
So DSPD has a process called ISO, and I always forget what the acronym means.
In search of?
In search of?
That's how
I think that's great.
No, it's invitation to submit an offer.
Yes, but I always think of it as I'm searching for somebody. So, but yeah, that is correct. Invitation to submit an offer.
Yeah, so I have a question. For some reason, I can't use my chat here, but I have a question, Rick. I'm Cecilia. I don't know if it's 100% pertinent to what you were covering, but it has to do with UPI. I spent a long time, a couple of weeks ago, on UPI trying to find a location for that table that details the employee ratio, employee client ratio. Do you know where I would find that?
Are you talking about so this is about a worksheet rate like RHS?
Exactly, the worksheet. Yeah, where would it be?
You can connect with the support coordinator to get the worksheet, a copy of it.
Also, so it's something that is not on UPI on the client's plan?
Not yet. We're currently working toward both revitalizing the request for services process and integrating the worksheet process inside of USteps and UPI, so providers would have access to the worksheet data. That effort's underway, but it's going to be a little while before.
Okay, so in reality, unless if the support coordinator doesn't share with us, we don't have any other way to find it. Is that correct? Right now.
For today, that's true. It'll be different.
Okay, and then I see. And then my last question on UPI, as far as
well, I guess Cecilia's frozen, so we'll move on to another.
Can you hear me?
Oh, you froze up, so we couldn't hear you.
Oh, I'm so sorry. I have one last question. On the incident reporting on UPI, when I am reporting a new incident and I do all the, the summary and all that on the first page, then the second page wants more details and I do that and then I submit. I did that all just last week, and then 4 or 5 days later, the support coordinator contacted me and said that that day was my deadline for the details, and I was confused because I've done incident reports for years and years, and I've never had that problem before. Is that something new that incident reporting has changed?
No, there have been no structural changes to incident reporting. When you submit the incident, you have to check whether the validation requirements have been fulfilled or not. If there's a validation issue in the data, the submission process will not be allowed. If you need to fix something, so you'd have to make sure when you submit, you check the top of the screen to see what the system is saying. So if
it said submit all in green, and it said everything has been, went through. So that's why I was surprised that. It was nice that the support coordinator caught that, and he was able to alert me.
Well, if you have a specific question about an incident report, we can get with you offline.
Okay, great.
And look at that.
Thanks, Rick.
Okay. Let's go back to the question about how support coordinators choose a provider. So the ISO process is coordinated with DSPD,
What?
and they help facilitate the communication between providers and support coordinators about the selection of a provider and what kind of providers may be available to deliver the service. So that process is facilitated there. Another question is, how long can agencies wait to get a client? I'm not sure what that one is asking. If it's in general about what to expect about how long to wait, everything is driven by the person's need and whether there happen to be new people coming into services right now or not. There are different circumstances about when that happens. This year, we did receive funding to bring more people into services. So beginning this fiscal year, the DSPD were going through a process of recruiting providers to care for those people, support them. Next question is, as a provider, how would you go about goals that aren't necessarily applicable to the individual any longer or aren't really trackable? That is a great conversation to have with the planning team, where the support coordinator and the person and others involved come together and look at what the person wants in life. And it's certainly appropriate to look at their goals and say, is this goal done? Have they accomplished the goal? In the example we were doing earlier about Rick wanting to cook for his family 3 times a week, if he's consistently cooking 3 times a week, then it may be reasonable to say that goal is accomplished and we could focus on something new. So definitely involving the person in that conversation to determine how to structure the language so that it is reasonable, trackable, the person's still interested in it, still wanting to achieve it. If the goal is too vague, too broad, like the person wants to access the community, that may be really hard to track because it just isn't specific enough. If they want to access the community, then what about that is important to them? Is there some place in the community they want to access? Is there something they want to do in the community that's meaningful for them? What about that is important? So that's a question I would ask is how specific is the goal? Is it clear enough? Do we know if it's been achieved? If it's not been achieved, why hasn't it been? What barrier is happening that prevents the person from achieving their goal? So in the example, the person wants to go on vacation. What I would do is ask more questions about that. What kind of vacation do they want? What place do they want to go? What setting do they want to be in? What about a vacation is fun for them? And just get more information, drill down a little bit more to figure out what about a vacation is meaningful for them. All right, next one. Is there a link where we can look at the acronyms? That's available in USteps, as I mentioned. There's a search panel under the CAP searches where support coordinators can look up the service code descriptions. Currently, that option's not available in UPI, but it's a possibility we could add it there if providers are interested in. And in general, in UPI, we're definitely interested in hearing what providers will find useful in UPI. So if that feedback is worth giving, then send it to the email that Lisa put in the chat, and we'll happily address it. Next one is, will there be another training where we can go over the PCSP document and the budget plan approval process? Lisa, do you want to address that one?
Yes, and I also want to say I did put in, I always go to the scope of work, which has a list of most of the service codes and what they stand for. So that's another place you can go, and I put a link in the chat for that. In terms of the next training, we're going to do an overview of the person-centered support plan and what the report looks like. I hadn't thought about the budget process in UPI. That's not part of what I do in my job, so it didn't occur to me. So thanks to that little tip, we will add that in as part of the curriculum. And again, that next meeting will be on August 15th.
All right, the next item is, can you remind providers that support strategies are due 30 days after the start date of the plan? I have some that have been waiting for 3+ months. I suppose one question there would be if providers have questions about the supports, is there something that should be clarified? Or is that, I suppose it's just a conversation to have with the provider about where that's at. Next question, is there more funding for new clients off the waiting list? When will this funding go into effect? The legislature did give us funding this year to bring people into services, so that process is underway. We have the course of the year to be doing that because the people and their eligibility have to be reviewed, and it takes some time to get them into services, but that's underway. Do you have any numbers regarding how many clients generally receive PERS, personal emergency response systems, each year? I know that data is available. I don't have it memorized at the top of my head because I have no hair on my head, so I can't put anything on it. I'm just limited in that way. But we can get you the information. If you want to send an email to the email address Lisa put in the chat, we can respond to your question. Next question, can ISOs be sent to more than one email? I think that's a good question for the team who do those. I don't know what parameters they use to send those, but we can look that up with that team and respond. If you don't want to send that question to our email address, we can follow up with that. Next one. I'm glad this training is happening. It's great for us to understand each other. We're glad everyone's here and that we can share some information together, so we appreciate the opportunity. Next one, SCEs would like to have data describing the situation and support needs of clients and ISOs. So that's good feedback for the ISO team. The next one is have Outlook or Gmail auto resend them based on the email address or subject. I guess that's feedback for the ISO team. Okay. Next question is, I have someone who's been waiting for services since he was a kid. How can I help him as a provider as he continues to wait for approval of services? Well, there are some support options for people on the waiting list. You could reach out to Jamie Douglas. She may be able to provide some information about those options. They are limited. They're not meant to be ongoing. So there is a process for determining if those options are appropriate for the person or not. But certainly reaching out to that team. Jamie supervises the waitlist and intake teams. So she is the best person to ask that question to.
And I'll just chime in since I spend a lot of time at resource fairs with our intake team. Know who the waitlist worker is and check in with them at least yearly, but as needs change, make sure that they call in and let their waitlist worker know or communicate with them via email or however they do that. And just keep them apprised of their needs. It may or may not move them up or down, but at least it keeps their needs updated and current in their records. So that's our suggestion.
Next one is there a way that ISOs can be sent to providers based on service need? I've been receiving many ISOs via email, but none of them have included my service type yet. Well, I'll give you a look at the future that we're currently considering. We want to make some progress on making the ISO process more electronic and more efficient. It will mean introducing some new capabilities in UPI where providers can indicate what types of services they deliver in what counties of the state, so that when an ISO needs to go, providers, that data could be used to route ISOs to providers in those areas. We haven't made any announcements about that new feature, and it's certainly not taking off the ground right now, but we do plan on having some work group opportunities for providers as we get to the point where that particular project will get started. So we're kind of excited about the future of that ability. We think it will be helpful for both the person and the provider and the support coordinator to have this process more electronic and more efficient. So that'll be cool. Next one is regarding ISO. When providers respond, it would really help families who are searching if the response addressed in the information in the ISO generic replies are not helpful. Clients want to know more details about services so they can more easily sift through the responses. So yeah, that can help with the process. What email address do I send the question about ISO emails? You can send that to the email address that Lisa put in the chat. Next
I
one.
just put email in there again. It's in there a few times in the chat.
Okay. Thanks, Lisa. What are the responsibilities of support coordinators to providers after sending out ISOs, especially when providers have responded with interest? Well, the response goes to DSPD, and then DSPD facilitates the conversation and helps the person with the selection of the provider. So more information about that may be helpful from the team who manages ISOs. We wanted to reach out to them. That would be all right.
Which one is the team that manages ISOs?
I believe it's Amanda Barr, isn't it?
So the email that Lisa just put in, that's not the one that I would use to ask this question about.
No. You can send this question to that email address, and then we'll do some research to see who the appropriate party is to respond to your question.
And Amanda Barr's team does the initial, like getting them from the wait list in transition into services. But after that, the support coordinator is the gatekeeper for ISOs, as I understand it. And so that would be the one that would help the person go through and determine which they want.
I think it was more like the technical question as far as if there's a team that is in charge of the technicality of sending the ISOs, and if I can add an email address, because I already forwarded my ISOs to my assistant, but then I don't get them anymore. And we've tried to work with the system, but it doesn't. It only allows it to one email address. So I was wondering if there is an email or a person I can contact, if they can help me with that.
Well, we can route your question to that party in DSPD and see what they can do.
Yeah, we need to do a little research. So shoot it to the community inclusion team and we'll forward it on.
Okay, and I have one last question. I'm sorry, I was typing, but okay. So I've been doing this for about 10 years, and I am a little confused on, so there's specific support coordinators that's very rarely, but sometimes they come that directly, that they work for you guys, that they're not private, they don't have their private agency. That specific client is with that DSPD support coordinator for the first year or so. So this specific one that I have dealt a lot with this person, it seems like the criteria is different when it's a DSPD support coordinator than what it is an ISO with a private support coordinator. And I'm wondering if there is a different criteria, a different expectation, or there's something there that is not the same. And so I'm wondering, I've never asked the question because I always feel so intimidated with this specific person. So, and whenever I see her name on the thing, I go, forget it. I won't even apply because the way we are treated is honestly not professional, and it's always a no. And it's depressing to even submit even to be interested because anyway. So I'm just wondering, is there a different expectation or different, because that's the message I'm getting from, but maybe I'm wrong, but just in general, can you enlighten me about that?
Well, I think that's a question you could send in that email, and we'll route it to the appropriate parties and have them respond to you.
Okay, thank you.
So here's a question. Looks like a lot of my responses to ISO and ready to a no response back. Are SE supposed to keep us posted about it if a client has a provider yet? That's a great question. I'm not sure what follow-up support coordinators need to do. That's a question that you could send to the inclusion team, and we can route it to people who can address it for you.
I'm feeling like we need some ISO training or something. You and I maybe, Rick, but that seems to be a hot topic today. So we'll also take note of that. Thank you.
Well, maybe that's an item we could include in a future training too.
Yeah.
Have the ISO team.
That's what I was thinking. Like, yeah, maybe we need some more information on that. So thank you all for the questions. We had one, what is the difference between DSP and DSG bill rate code?
Well, DSP stands for Day Support Partial, and DSG stands for DSG, Day Support Group. So fundamentally, they have a different scope of service. So they would have a different rate. I'm just pulling up the rates now for those. Let's see.
What did you say DSP is daily supports partial?
Yeah, it's a partial day support. I just put the scope of work link back in the chat so you can look at them. And to Dan's point, the rates are actually the same, just partial means it's not a full 6 hours as opposed to the day group rate, which is based on a 6-hour day.
Okay. Another one about ISO. Sometimes I get so many responses to the ISOs that it's difficult to respond to every single one, especially when my client is looking for something very specific. But I appreciate you bringing this up. I will be more mindful about responding to providers. Okay.
Great. We're helping each other out. That's great.
Mm-hmm. Yeah, it's awesome. And that's what we'd like to do with this future enhancement of the ISO process and making it more electronic, more efficient, as it can handle those things really well. Another question about the waiting list. Those determined to get off wait list is based on severity of their needs or by who has applied first. Well, the legislature sets the criteria for prioritizing people coming off the waiting list. The severity of need is one of the items that ranks people. People have a waitlist score that ranks them on the waiting list, and so that scoring mechanism is the one of the elements that determines when they come off, and based on available funding.
Yes, severity and length of time on the wait list. And then there's a third element that, of course, I can't think of right now. But those together make up that score.
All right. It's 1:54. Any other questions you want to look at? We've got a couple more minutes before 2 o'clock. Let's see. I understand that we cannot have waiver supports paid while other Medicaid coverage services are being covered. I have clients with no family or national supports. What is the best way to find them help at doctor's appointments? These clients are unable to handle doctor instructions on their own. I think this would be a great question for the waiver manager to get involved with. Each waiver has its own stipulations, requirements for support on this kind of scenario. So the waiver manager definitely is one to consult with on a scenario like this. They have a generic email address. I can get it for you quickly.
And while you're doing that, Rick, question about where will the recording for this meeting be accessible? The hope is to have it on the website, DSPD website, under other providers and trainings. But we're in negotiations about that. So in the meantime, you will at least get a link to the recording sent to you via the email that you got your invitation to join us today. So if nothing else, look for it there. And Rook put the email in the chat along with Nicole. Thank you.
All right. Any other questions you'd like to discuss?
Interesting feedback that the ISO document on the website is not editable. So that's something we'll bring up with our website people. Thank you for that, Nicole.
All right. Anything else people would like to?
Jenica wants to get an email invitation sent to her. And Rick, I know you're the keeper of the email, so I'm not sure how that will work for future. But remember, August 15th from 1 to 2, we will have our presentation on the PCSP overview and how to read the report.
Will
And
you send us a reminder for that, or is that?
yes, you'll be getting emails about that.
Okay. And could you, for some reason, I lost the chat here. Could you remind me of the email, the regular email, the general one that you said to send the questions to?
It is Community Inclusion Team, all one word, at utah.gov.
Okay. Thank you.
All right. Anything else?
Thank you, everyone, for your participation. Thank you, Rick, for that informative presentation and training on support strategies and goals. Thanks for the great questions. We're taking your feedback, and we really appreciate it. We'll see you next month. Rick, any final words? Oh, Natalie has a question.
Let's see.
Or are we hand raising instead of thumbs up? Gotcha. We're getting lots of praise, Rick. So there's that.
Excellent. We like praise.
I'm going to stop the
And
recording.
snacks. We like snacks.
Yes.